I'm Giuseppe Ronzitti from Geneton and Inserm, France. And I recently gave a talk to this year ESGCT conference about the overcoming of anti-AAV pre-existing immunity to achieve safe and efficient gene transfer in clinical setting. Um, so the fact is that we are using AAV vectors which are derived from natural AAVs, and so natural viruses basically that are in the nature. And so there are in the human population you do have individuals that are seropositive, and so they cannot be treated by AAV. So there are this is the main issue associated to the um, injection of AAV vectors um, in patients in a patient population, because you know that you will have a part of the population that will be not be treatable. Um, and so there are many techniques in this conference. I reported about many techniques that were used in the past to overcome this big limitation of AAV vectors. And in particular, I reported about one of the last technique that we developed in the lab, which is about the use of IDES, which is a bacterial-derived endopeptidase, so an enzyme that can actually cut away immunoglobulin. What happened here is that when you have an individual which is seropositive, you can think about treating him or her with this enzyme, and this enzyme will reduce almost to zero the level of circulating IgG. So this will allow you to administer the vector in a therapeutic window where you do have basically no neutralizing IgG versus against AAV vectors. So with them, we provided proof of concept of this concept in non-human primate because these are the only species actually that one of uh, the most characterized species that has um, that are seropositive to AAV vectors. And so we treated the monkey with a IDES. We treated the monkey, seropositive monkey, with the IDES, and then we administer a vector expressing human factor 9. So it's a coagulation factor 9. What is interesting in that when we treated seropositive monkey with IDES, we were able to achieve levels of human factor 9 that were actually therapeutic if reached in a patient, in a hemophilia B patient. Whereas when the seropositive monkey, were actually not treated by IDES, the levels were very low, almost nothing basically. And so this provide you an indication of what is the therapeutic potential of the combination of IDES with AV vectors in hemophilia B. What is also important to say is that although we provided proof of concept of the use of IDES against pre-existing titer of neutralizing antibodies, this can be in the future also translated to a setting of readministration. So AAV vectors, after the injection, they generate neutralizing antibody titers, and in principle, IDES can work also to this, so can actually transform the AAV gene therapy from a single shot therapy to a therapy that can be actually readministered in case it will fade with aging. So these are the two most important things: the increase of the patient's access to the treatment and possibility to readminister the vector in patients that already received the therapy.